The CEO and founder of MediSprout. Hi,
to meet you, Dan.
Doctor. Good, thanks very much for joining me.
Sam is good.
Sam is fine?
Yeah,
okay,
absolutely.
Very good. Thanks for joining me, Sam.
Thank you for doing this.
And my pleasure. So we're all about moonshots here at
Yes.
Startup Health Festival. That's one of the things that I love about Startup Health is
Yes.
the 25-year vision. Tell me about your vision for MediSprout.
Yeah, we started MediSprout because we wanted to create a solution that affects the things that are the biggest problems we have in healthcare, cost and quality, right? And so our vision is to do that through virtualizing healthcare. And our moonshot to do that is, we believe in 10 years, in the next decade, we can virtualize 75% of all medical office visits. There's no need that people need to go into their doctor's office anymore. We believe today it could be 1/3, but the way that we're building our technology, we're integrating devices and apps that patients use, so we can get their information together with the patient and their own doctor on a virtual call. And that's how we plan to affect that change.
So that's an interesting metric, that 75% of the in-person visits might
Sure.
go away over the next 10 years. What is the real impact of that, though? What does that mean to individuals, to payers, to providers?
Yeah, so the impact of that is, we think that the way that healthcare is structured now, affecting that change of reducing cost and improving quality is just really challenging. We believe this is a new mechanism where we can do this in a very thoughtful way. The one thing we know in healthcare that works in terms of quality of care is the relationship with your clinician. And if we can use virtual care to enhance that relationship with the technology that we have available to us, we think that we have a plan to show how we can reduce costs and by improving that continuity of care, improve quality.
That's excellent. And I understand you have partners that are working with you alongside this. Are you based in New York?
We're based in New York.
And you have a partner there as well, right?
Yeah, we have a partner there as well, meaning like
Mount Sinai?
Mount Sinai is our partner. We're really proud of that relationship. It was one of our early relationships. And we have a lot of traction there where we've shown cost savings and a lot of patient satisfaction and provider satisfaction. We also recently just signed a very exciting collaboration with a large community healthcare system. It's one of the leading community healthcare systems in the country, where we'll develop use cases to affect the other 1,500 community hospitals in the country, which are really struggling to provide care to their communities. So we're really excited about both the Mount Sinai relationship, which is evolving, and this new relationship we have, which can really help us create impact across the country.
Mount Sinai is an organization I've known for some time, and they're really thought leaders and doing a lot of great innovation. So congratulations on working with them.
Thank you.
So as we look look back on 2019, are there any big accomplishments that you want to talk about?
Yeah. So a lot happened. For us, our existing customers doubled their volume of visits. We signed dozens of new customers, but the collaboration agreement I was just mentioning was one of the big things for us from 2019. It took a little while to get to a place where we signed that agreement because we wanted to make sure that we were both incentivized to accomplish the goals that we set out, which is improving continuity of care on a large scale, right? So with this collaboration agreement, we will create use cases with this community hospital system, which we can then go out to the other, as I mentioned, 1,500 community hospitals in the country and provide them a virtual care solution that they can implement as well. So that was one of our big accomplishments that we rolled out there. And specifically, there's a diabetic employee health diabetic project we're working on with them as our launching point. That'll be one of many use cases.
Brilliant. Sam, I'm curious about you personally. You trained a long time to become a medical doctor. This is not something you just decide, I'll just spend the summer doing this. You spent years doing that, and now you've shifted gears entirely to become the CEO and founder of MediSprout. Are you trying to get yourself out of a job? Was there something about trying to reduce doctor's office visits, and that's what you trained to become? What did you see or experience that you thought there's got to be a better way or a different way, and I can help build it?
Yeah, Dan, I think about this a lot. I love practicing. It was the thing that it drove me every day. I loved my training, actually, and I loved my private practice and my academic practice. But when I realized, there was a frustration that I couldn't really define in terms of my daily practice. But when I realized that I was spending only 1/4 of my time actually providing care to my patients, and 3/4 of my time doing other stuff, I realized I I wasn't effectively providing care to people, and I had to do something to change it. Myself, my colleagues, we are our best medical resource. I argue that we can provide care as good or better than any technology, but we're not being utilized. We have to do something to change that paradigm, and that's my mission. Through this virtual care solution, I think we can do it.
And what I love about what you're doing is that you are a doctor, so you experienced some of this firsthand, you've seen the problem firsthand, and I understand also that you have doctors that are helping to design the solution that you're working to do.
Yeah,
right?
We really are a clinically driven organization. My colleagues are physicians as well. We really try to vet down what the problems are we're facing every day and address them. When you sit in an office, and I say there's nothing like sitting in an exam room, sitting across from a patient, realizing I can do a lot more to help them, but the structure around me does not allow that. It's a powerful motivator. So that's why we have other clinicians helping us design and implement this tool, because I think that when you have that experience, it dramatically impacts the way that you can grow it.
Before I let you go, I just want to hear a little bit about what you have in store for 2020.
Yeah, so 2020 is a big year for us. We're going to be raising funds for the first time. Everything's been self-funded to date. And the reason we want to do that is we are ready to scale. We've really thoughtfully taken time to design this solution. We've said no a lot more than we've said yes. We have everything in place to push go. So our fundraising is a big part of this. And then as an extension of that is scaling. We're ready to scale. It's a software as a service solution that brings a consumer feel to the relationship between a provider and patient. And we're ready to grow that and change the conversation in healthcare from just creating solutions to creating solutions that actually, as I said, improve cost and quality of care, because we need some fundamental change, and 2020 will be the year that we do it.
Well, I look forward to hearing about your success over the next 12 months. Good luck on the fundraise. And
Thank you.
For everyone who's watching this, you can find out more about Sam's company by going to startuphealth.com and searching for MediSprout. So Sam, enjoy the rest of the festival.
Dan, thanks
Good
so
luck.
much. Appreciate it.
Cheers.